Hello, my name is Ashley Agnan Montero and I'm a fourth year medical student. So today I want to perform a physical examination on the eye. May I know your name, please?
Murugan Nivas,
May I know your age?
25.
Okay, so I want to perform the physical examination of the eye on you. Is that okay?
Okay.
Now, so we'll perform the visual acuity test. So for that, can you see the Snellen chart?
Yeah, I can.
Yeah, so can you cover your one eye, right eye? Okay. Can you read the first letter?
E,
Yeah. Can you read the second line?
F, P,
Okay. So can you? Which is the last line you can read?
D, E, F, P, O, T, E, C,
Okay. Can you read the line about that?
F, E, L, O, P, Z,
Okay.
D.
Can you change your eye? So which is the first you can see? First alphabet.
E.
Okay. And the second?
F, P,
Okay. And which is the last one? Can you see?
E, F, L, O, P, Z, D.
Okay, now we are going to do the visual near visual acuity test. We are going to do the resultant bond test for that. So I want you to read the smallest thing possible.
Okay.
Close your one eye, please.
Okay. 9, 5, 8, 7, 4, 8, 7, 4, 5.
Okay, so do with the next eye.
8, 3, 7, 8, 5, 6, 4, 2, 8, 7, 2.
Okay, thank you.
So now we will do the gross eye examination of the external eye. First we check the eyelids and also the eyebrows and palpebral fissure. Next we note the level of the eyes and eyebrows to see if they are symmetric or not, as well as their positions. Next we look at the eyelashes, eyebrows and lid margin. Next we look for any kind of masses, edema, inflammation, scars, ptosis, or any kind of crusting in and around the eyes. Next we check the bulging of the eyes by placing the camera on top of the patient. Okay, now we will look at the conjunctiva of the patient.
Okay.
We will be looking for congestion of blood vessels, redness, or any kind of edema. We will repeat the same procedure for the other eye.
Okay.
We should also check the sclera for any kind of discoloration, bulging, as well as the corneal shape, size, or any kind of clouding or any kind of foreign bodies in the eye.
Look here, bro.
We should also look at the pupil for its size, shape, and color. We check for any kind of leukocoria present or not. Next, we will perform the direct and contextual light reflex for the pupillary constriction. Room light should be dim. We look for the pupillary constriction in the eye. If there is constriction, according to the reflex, the other eye also constricts. Next, we will look at the other eye. Next, we will perform the swinging light reflex test to detect the afferent pupillary defect. This is to detect the difference between the two eyes and how they respond to light.
Okay.
Now we will be looking at the anterior chamber depth of the eye. For this, we will shine light from the temporal side of the head and shine the light parallel to the iris. And we look at the nasal side of the iris. If 2/3 of the iris is in the shadow and the chamber is shallow and the angle is narrow or not. Now we will perform the cardinal field of gaze for each muscle in each field of action. Ask the patient to follow the object in hand. We check for any kind of nystagmus or lid lag. We are assessing the cranial nerve 3, 4 and 6. Now we will look for the convergence of light. Ask the patient to follow the object. Okay, now we will do the corneal light reflex. Now we will do the cover and uncover test. If there is no movement in the uncovered eye, then the eye is normally aligned. Now we will be doing the visual field test.
One hand on the eye. Okay, can you see this?
2,
Okay, can you see this?
3,
Okay, can you see this?
5,
Can you see this?
2,
Okay, change the eye now. So can you see this?
2,
Can you see this?
3,
Okay, can you see this?
5,
Can you see this?
1.
Okay.
Next, we will do the digital tonometry examination. We have to palpate the eyelids, look for any masses or an increased IOP.
So the final examination is a fundoscopy examination using an ophthalmoscope. We have to put the dial at 8 plus 8, and we should be approximately 1 feet away from the patient with ophthalmoscope. See if the light is working, and first we should see if you can see the red orange reflex in the patient's eye. Then slowly at an angle of 15 degrees we have to look in the.
We will look at the retina, we will look for the blood vessels constriction point so that we can measure the CD ratio of the patient. We will look for any kind of hemorrhages, edema, etc. Then we will perform the same procedure on the other eye.
If we are viewing the patient's right eye, we have to use our right hand and our right eye also. Thank you.